Welcome to the Finance module. We're excited to have you, and we hope that you're excited to be here. I'm Professor Joy Vollerich, and I'll be working with my colleague, Professor Jeff Helton, to walk you through this module. I've spent roughly 20 years in the healthcare industry, primarily on physician practice management, and about 7 years ago, I moved over to academia, and I teach healthcare finance. We designed this course to help you better understand all of the different revenue and expense components in a healthcare facility. In my portion of the course, I'll be walking you through the different expense components. So we'll be focusing on clinical staffing models, personnel expenses, supply and drug expenses, how those are generated, and how those all come together in a healthcare facility. What I'd really like you to get out of the course is I don't want you to be a finance professional. You can breathe a sigh of relief over that. But what I want to happen here is when you're sitting in meetings with colleagues and financial topics come up, I want you to really have a good sense of what they're talking about. I want you to be able to take the information that you learned in this class and apply it to decision making so that you can become a leader in your organization.
I'm Professor Jeff Helton, and I will be talking to you about the part of healthcare finance that involves getting paid. Pretty important to us, right? My background, I'm a former health system chief financial officer with over 25 years experience working in healthcare organizations generally that had gone into bankruptcy or receivership, and I helped bring them out. And one of the things that was very important in those experiences is helping the organization get paid. And so hopefully I can share some of those experiences with you over the next few units, and you'll take away from this experience a much better understanding of how organizations get paid in healthcare. Because it's not like going to a grocery store where you buy a can of beans or a bag of flour off the shelf, you give them a credit card or some cash, and it's all settled up. But instead, you'll provide services today and wait 30, 60, 90 days or more to get paid. And so it's very important that you do things the right way to get paid promptly, the amount that you're owed for the services that you provided. And there are different mechanisms that we use to get paid. Very much like when you go to a restaurant. You can buy services a la carte, individually, or you can buy a combo plate. We'll talk about that. And we'll talk about the different sorts of ways that those payment mechanisms influence the way you manage an organization, and how you can maximize the amount of revenue that you collect in your organization depending on how you're paid, because that'll influence how you run your organization. And we'll wrap up with talking about health reform, a new change in the healthcare industry, and it's going to influence some of the ways that you'll do things in the future. And bring all that together so that you understand the importance of finance in the big picture of managing a healthcare organization and help you do the best job you can to manage a healthcare organization.